Hello, everyone. My name is Peter Pruyn, and today I am delighted to be joined by my local colleague, Katie Markelz. Welcome, Katie,
Hi, everybody. Thank you.
for what I'm sure will be a very engaging conversation around women's health and our healthcare system generally. Um, so, as you know, Katie, one of the things I love to do in these conversations is have my guests introduce themselves because I find I always learn something about them. So, what would you like our audience to know about you?
Yeah. So my name is Katie, and I am an osteopathic physician who made a giant leap this spring and hung my own shingle here down the hall from Peter to pursue holistic medicine, integrative medicine with the backbone of osteopathic medicine and osteopathic manual medicine. Um, and yeah, here in Northampton, Massachusetts, um, and delighted to be here.
Wonderful. And Katie, I'm just curious, would you care to introduce us to some of the artwork that's decorating you behind you?
Sure, absolutely. So I am not only a physician, but also a very busy mother. I'm actually expecting my third boy this fall. Um, but I have two little boys right now, and they go to a wonderful, one of the perks of working in downtown Northampton is I am a block away from my sons where they go to preschool. And so they do plenty of artwork there. And more recently, these have come home this summer. So this is Everett. He's 18 months old, and this is a pear. So he did all the brown kind of stipling across the page. And then we attached, the pipe cleaner. And so that's Everett at 18 months. And then this is Charles at 5 years old. And very proud of himself for graduating from scribbling to coloring within the lines. And
Absolutely.
very much into rainbows and color.
Hmm.
His favorite color is rainbow, in fact. And and yeah, I was telling you before we kind of hopped on that yeah, this is kind of my happy corner where I have all the kind of love and nurturing from my family and my boys and some photos of the family and that kind of thing. So and you know what? I sadly am recognizing I do not have a picture of my puppy, and that's gotta change. So that'll be the next update. I have a 2-year-old golden doodle as well. So yeah, thanks for asking.
Absolutely. Well, I'm already get a sense from that you care about trying to make your work in a way homey. And so maybe that's a good segue for us to just ask you, what is an osteopath and how is it different from traditional medicine?
Yeah, it's a very good question. And a lot of times I start with the history of osteopathy because I think it
Right.
so very much explains where it's come from and where it's going,
Mhm.
and perhaps why there's a resurgence of excitement around this kind of work these days. Um, so Andrew Taylor Still is the founder of osteopathy. He was a traditional MD back in the late 1800s, and he essentially went through a horrific tragedy where he lost his children and wife
Hmm.
um, to, and I forget who had what, but there was basically a plague of both pneumonias and spinal meningitis. And of course, the standard of care at the time was unfortunately quite toxic. Things like, arsenic, mercury, leaching, et cetera, et cetera, et cetera. And certainly they did not get better. They got worse and ultimately passed. And so he really kind of went into inward and um, became pretty, I guess, distraught and distressed with the fact that um, you know, this. mainstream medical thing that I've been a part of, there's got to be a better way. Um, and so with that, he turned to what he knew, which he was the son of a preacher, so he definitely had a spiritual component to his childhood. Um, he also was a naturalist. He lived in a rural community where he had a lot of land and kind of open space where he could really kind of engage with the natural world. And then as a physician, he really loved anatomy and physiology. And so he took those three things and really kind of dove in, as all great forefathers and discoverers do, and found this marriage of all of these things um, in what he deemed and called osteopathy. Um, and unfortunately, to his dismay, upon trying to bring this new discovery to the mainstream medical community, he was quite ostracized. In fact, the medical school where he had donated time and finances previously suddenly shut their doors on him in the with the thought of him kind of presenting this newfound work. So he went west and landed in the middle of the country, and he set up his first osteopathic school where he said, this stuff works, and there's a community that's excited about it, and I can do it somewhere else. Um, so I think this was still it was kind of the turn of the century when he started his first class. And what was so unique about his osteopathic school was that, at the time it was physicians were white men. Um, However, for his osteopathic program, he felt very strongly that people of color and women should be included in the student body. And um, anyway, needless to say, it really took off. I mean, people really pilgrimaged to this center, not only as students who wanted to learn this stuff, but as patients who wanted to get well. And part of what drew people was the word of mouth of the remarkable results that this new kind of practice was doing. So, fast forward to where we are now, and there's something about this really holistic, comprehensive model that really looks at mind, body, spirit, and orients toward folks and their health as opposed to their disease, that is so welcomed, thankfully, in the community that we're in. Um, and I have to say, I mean, it's been a tremendous journey, and also validation and reassurance of my career decisions to really kind of have faith in this work and do this work. And I will say I come from a very mainstream training background where I trained in internal medicine. I did hospital medicine and primary care work for about the training, let's say a cumulative 8 years at least. It's hard, you lose track in training, but where I was really, in this mainstream model, and my initial goal was really to kind of blend the two. However, I think more and more I found that the best way to do this comprehensively and holistically in the paradigm I wanted to do it in was to kind of branch out and do it in my own kind of healing space.
Hmm.
And I guess just to also I think some people need a description of like, but what are you doing, right? Like, what is osteopathy? Like, okay, there's the history, like there's the concepts, and so much of it is based on principles all the time, and even, but when we talk about osteopathic manual medicine and treatment, it's a hands-on healing modality, where with mostly very kind of gentle touch. I am what they say using my sensing feeling fingers as I think I'm horrible with who said what quote, but I'm one of the founders. I want to say it was still. Um, anyway, my sensing feeling fingers to individually kind of diagnose what's happening in the body and then working with the body help restore the health of the system. And not only in the body, by the way, also in the mind, in the spirit, the emotional, all of the traumatic, all of the things that present in a whole person is what I'm addressing with my hands as the patient lays on the table.
Mhm. That is fascinating. I am so grateful to know that story of the profession. I've never heard it before, and how you intersect with it. And then you've alluded to the fact that at some point you made a choice specifically to go into private practice. So can you say a little bit more about why you decided to do that?
Yeah, absolutely. I think so my osteopathic journey started with me, quote, stumbling into it as I saw it. It was like, oh yeah, I went to University of Pennsylvania, everyone there goes for MD, and I was like, and then okay, I'm considering other realms. I'm not so sure. And then some mentor along the way says, what about a DO? And I think that suits you. And then suddenly I'm at DO school, and then, I'm like, and then I become this nerd who gets into the hands-on medicine portion of it and the history, and it's like, and I just stumbled into that, so there was this, but now I would say it was really kind of this kind of calling and soul purpose. Um, and I think there's something that happens to a person when you're operating in a place that's not that. And so I almost feel like my I follow Canadian Hungarian physician Gabor Mate, and he talks about when the body says no, and my body was saying no, and I had to listen, and I think it was such a powerful learning, one that I use in the teachings of my patients to this day. That wow, yeah, there's something wrong here. This is not who I am. This is not where I want to be. Um, I really did have this kind of higher purpose and calling to do healing work, as opposed to disease care, which really felt anyway. Yeah. So it got to a point where I just fortunately had wonderful people in my life who said, you know what? We support you. Just do it. Just do it. And I was terrified. And you met me in the beginning of it, and I was terrified. I was like, how do I get people to find me, and who? And I'll tell you what, I mean, there is some magic that happens when you just kind of get on that road. I mean, you blossom and your passion radiates, and people notice. And then they tell their friends, and then their friends come. And then before you know it, I mean, I just had to close my doors to new patients because,
Good for you.
I don't know how many 6 months later, I'm
Good.
like, we need to pause here because, I'm only human, as I tell my patients too. Um,
That's wonderful, Katie. Congratulations.
yeah, thank you. Thank you. I think, I see it as this bridge that's so missing in our world of medicine, where we have this one world that is so disease oriented and focused on, let's get the diagnosis so we can determine the treatment, let's surgerize or medication or what have you. And there is, believe me, I have respect for internal medicine. There is a time and a place for that, and yet it's not necessarily holistic and comprehensive. And then on the other end of the spectrum, we have this alternative world, which is flourishing here in Northampton, and it's a beautiful thing. And yet, sometimes it's too alternative, or and the worlds are siloed, much like all of the worlds within our conventional specialty medicine. And so, yes, there is this role of being this kind of bridge provider that can say, hey, we got to order those labs and make sure your thyroid hormone's not off. We got to do this. I think you probably have a compression fracture in your back. We need to check. You know, there's a role to being that for the provider that has those tools and also has the tools to reconnect someone with their health. And so it's just this beautiful marriage that I found myself in as the, once lost duckling of who am I? But there is this need for
Mhm.
that kind of bridge approach. And so I guess I just feel moved to say that like any osteopath who's listening, student who's listening, young, early physician, even later physician who's just like totally burnt of this work, I think this is one avenue to restore it and really kind of do the work in the way that we as young, naive pre-meds and medical students set out to do.
That's beautiful. Thank you, Katie. Uh,
Yeah.
and one of the things you're doing is help me reflect on my work because, as you know, as a trauma therapist, I work mostly with female survivors. And because I'm not a doctor, I'm not going to offer a medical approach. And so I'm left with what psychotherapy can offer. And as you and I have talked about, one of the things that I've learned, fairly recently that certainly wasn't covered in graduate school, just to focus on women's health for a moment, is that women experience far higher rates of chronic pain than men. And I would really love to hear your perspective on why you think that is.
Yeah, it brings up for me I have two qualms with modern medicine so far. I mean, maybe more, but but I will say it comes up the two that come up over and over again. We've already touched on the one that is really, uniting mind, body, spirit in the whole person treatment approach. And the second is the sheer and utter neglect of women's health.
Mm, mm,
And that, I mean, it's very interesting. I did not set out to do women's health, but here I am. I mean, this is who presents to me. It's interesting. You don't even know what you have to offer until the patients show up, and then you say, "Oh my goodness, this is a passion of mine." And I will say, I mean, on a historical and society level, women go through hell. And I mean, between, starting with from a young age with adverse childhood events and traumas and caregiver syndrome of having to care for everyone else but themselves. And I mean, there's a lot here that's psychosocial um in orientation and unfortunately, what happens after decades of living this way, um, your system essentially burns out. And I talk to patients about it's almost like this kind of cumulative life experiences, stresses, traumas, whatever it is, um, where they really, the other famous one, the body keeps the score. I mean, it's so relevant to my practice in that it, every single thing that we lives in the body, and especially if we don't have the time and the space to process it, and it's, let's say, a very major event or even a cumulative, what becomes a major event in the case of smaller T trauma, um or maybe there was a big car accident or whatever it was, and whatever these things are, they accumulate in the system, and our body is so good at regulating toward health that we live with it, we're okay, okay, okay. And then as it feels in the moment, there's this day where you are not well.
Mhm.
And you go to your doctor, as you know, as any good patient would, and maybe it's an autoimmune illness, maybe it's, maybe they chalk it up to PTSD, maybe it's endometriosis, maybe, maybe it's hypothyroidism, all these very common things. And, people are like, well, why? How did this happen? Like, what happened? Like, I was fine. And I mean, fortunately, I borrow and learn a lot from the functional medicine world now, which is really looking at what they call the timeline. And well, what happened in the last 10 years? How about the last 20 years, 30 years? Because guess what? It takes that long, 10 to 30 years, they say, to develop a chronic illness. And so, talk about layers to peel back, and a lot of reflection work to be done. And it really is, I mean, disease can and illness can be set up on, it really is a, what should I say, like, I guess integration and accumulation of psychosocial and spiritual and emotional, traumatic, physical, all of the worlds of who a human is coming together to create this illness.
Mhm.
Um, and that's what we're missing in mainstream is that we're so focused. If Are you healthy? Oh yeah, physically I'm healthy. It's like, well, what's happening mentally? What's happening spiritually? How are you doing with work? How are you doing with sleep? All of these very important things that if they're not going well, you know, it's kind of accumulating in your system and then you're gonna tip. Um, and so I'm really forgetting your original question, but so much to say that yeah, chronic pain, right? Yeah, is 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 almost like this end res not even end result. I don't want to even say end, but it is a result of so much cumulative
Mhm.
lived experience.
Mhm. Mhm.
And and I mean, on a physiologic level, it's a nervous system that just cannot anymore.
Yes, exactly. Well said.
Um,
Well said.
so
So, given all that, I'm curious, when you meet with specifically women with these chronic health issues, do you find that there are certain uh, little tidbits of psychoeducational or medical education that you find yourself giving over and over again to try and, um, just explain why this is happening so they blame themselves less?
it's a great question. I mean, I when you said blame themselves, so what came to my head is like self-compassion and self-love. Like, and what does that mean? And that is such a hard thing. Um, but so one place I start with people is, you know, I really do think I come from this, primary care general medicine background, and there is so much to just lifestyle medicine in general and thinking through. But the idea of even so many of us are in here, and even just getting present with your body and learning to feel and listen to what's happening in the body can be extremely powerful, and a good way to kind of shift from the, I guess, yeah, from the kind of broke it, like I'm broken model, um, of just, I guess maybe the word that comes to mind is curiosity, just really shifting from this and curiosity discovery, from this, okay, they told me I'm broken, like identity almost, and shifting more toward, well, so what is going on for my body and where is that coming from and what could this mean and why is this happening now and how can I learn from this? And that mindset shift can be tremendous
Mhm.
as a way to really kind of get started on the healing journey.
Mhm.
Um, much like we can physically, strain our knee and have a we call it like an osteopathic. It was initially an osteopathic lesion, but like anyway, a dysfunction in physically, let's just say, let's say you have a physical dysfunction of your knee. So too can you can have a physical manifestation of a mental orientation dysfunction,
You should.
which is, I mean, you know, it, fascinating to think about.
Yeah.
There are some functional medicine psychiatrists actually who talk about this phenomenon, how much kind of that mindset shift, that perspective shift, um, can alter physiology
Hmm.
and get people unstuck.
Hmm.
Because I think a lot of us get stuck. It's just about kind of getting and there's an osteopathic text that's like life is motion, right? And so, I mean, really, it's just like getting that momentum.
You
Yeah.
know, as you're talking, one of the things I'm gleaning is that, correct me if I'm wrong, but one of the ways that you work is to try and uh, recruit the patient into their own healing, and to a degree. And one of the things that's very interesting to me about that, um, is exploring the dynamics of authority in a healthcare provider's relationship with the patient or client. And
Mm.
you and I have had little conversations around, for example, whether you call yourself a doctor or whether call yourself Katie or something else. Would you care to talk about the dynamics of authority in your relationship with your patients?
Yeah. Yeah. It's yeah, there's so many layers, but
Exactly. There are.
there's so many layers. So just, I guess to break it down a little bit, I mean, the first thing I will say is I am very informal and personal and personable, and I show up as a human just like the human in front of me. And I believe so strongly in working collaboratively and from a similar level. And I think there's a lot of therapeutic benefit to that. And then there's the fact that I'm a doctor, and I worked hard for this, and it was not easy at all. Um, and it also affords me, as we've talked about, kind of this ability to bridge worlds. And so some of my first patients kind of saw me in this lens of, a healer. And and I and I agree on a level. And I want them to know I'm a healer physician. I have a colleague who calls himself a physician-osteopath, which is interesting to me. And I've kind of sat on that. But there is this tremendous depth of training and knowledge that is just so unique when you've done the medical training here in the US. I mean, the things I have seen, it almost feels, I mean, it is intense, right? Like it is just, I mean, you're there all the time, seeing all the things on the ground level, birth, death, everything in between. Um, and so you really learn a lot about the depths of the psyche, of physiology, of how medications can alter all those things. You you hold hands of family members, you cry with patients. I mean, it is really profound, the level of experiencing that comes with medical training. And so on a certain level, that feels very irreplaceable and very important in who I am showing up as a provider. Um, to me, I think what I'm doing is primary care. I think what I'm doing is the best primary care and is the best preventative medicine.
Nice. Yeah. Beautiful.
And our world doesn't see it that way. Um, it's seen as alternative. I suppose it depends who you are, right? What your perspective is, where you're coming from, what your lens is. So, um, anyway, yeah. So it's like, yeah, who am I, right? Is it, maybe I'm a physician-osteopath. Maybe that's a good,
Mhm.
and that was a very intentional way of saying, and as a side comment to that, osteopathy is an international practice. And there are many osteopaths internationally who are working as osteopaths and not physicians,
Mhm.
in which they have gone to osteopathic school, not medical school. So
Interesting.
it's very unique in the US. And
Mhm.
I think we do. We have a little bit of an identity crisis. And I don't think it's just me.
Mhm.
It's like, who are we and where do we fit in the picture of medicine
Yeah.
in the US? And I have a lot of people asking me to be primary care, and as much as I feel like this is good primary care, our system does not value that, and I cannot afford to be that.
Yeah.
Um, and so,
Fair enough.
yeah,
Yeah.
it's what it is.
Okay.
Yeah,
Rich landscape.
yeah.
Well, there are lots of things we could talk about, but I guess I feel I'm drawn to just giving you some space. What are some healthcare topics that you rarely get to talk about that you would like to talk about?
Yeah, great question. And I think there's two things that come to mind that um, have become a part of my practice. And so the first is that kind of that functional medicine approach to health and well-being. And I suppose I fell into this in recognizing that osteopathy can do so much, and yet we live in a new world 150 years later. And there are things really working against people's healing that need to be addressed on a more medical model. Um, and so the things I'm thinking about are a lot of environmental toxicities, pesticides, herbicides, uh, electromagnetics, um, mold, Lyme, chronic viral and bacterial infections, to name a few. Um, and they all really disrupt the normal functioning of our organ systems, some of which are very important in healing. For instance, are your kidneys, liver, and gut working to their best abilities? And if not, then you're unable to live well in an environment that has so much toxicity, because those are so important for regular clearing of our exposures. Um, and so I focus a lot with patients on how do we reboot your nerve, your liver, your kidneys, your gut. The other thing that comes to mind is your nervous system. Um, people's nervous systems are fried. We used to be hunter-gatherers. We used to live with as one with nature. I mean, life was simpler in certain ways. And you see this in these beautiful remote villages still, but much of us are operating in a very mm, I guess, kind of productivity driven worlds, which requires us to operate in a very active headspace all the time. Um, and so it brings me to the autonomic nervous system, which has a sympathetic component as well as the parasympathetic component. And that sympathetic is that fight or flight component. And that's where we live, a lot of us. And without that parasympathetic, which is rest and digest, and the balance of those two, we get toxic along with our world.
Hmm.
Um, so that's another, you asked about getting women into kind of shifting toward a healing. And that's another one is just like, how do we bring up your parasympathetics? How do we balance your autonomics? And I mean, that is a profoundly healthful thing. We don't know how to rest anymore. I mean, there's probably a reason there's been a resurgence in nature bathing and, all these things that make people feel better.
Yeah, that,
So,
that's so simple. Just put it that way. We don't know how to rest anymore.
yeah,
Yeah. And the profound consequences on both physical and mental health. And it also makes me think about my work that, a lot of it is, in so many words, teaching people how to rest, even just for a minute or two in the middle of something stressful. Makes all the
right.
difference in the world.
Yes. Yes. The thought of, uh, you would know this quote better than me as a psychotherapist, but before every response, there's a pause.
Ideally.
Yeah. Just that concept of that pause can be so profound.
Yes.
So yeah, in my busy moms, I'm like, okay, what micro moments can we take advantage of?
Yes, exactly. Yeah,
Yeah.
exactly. Yeah, and a lot of this is just trying to uh, insert that pause that can give birth to new choices.
Right.
Yeah, yeah,
Yeah, we can be very reactive.
exactly. Okay. Um, so it's now
Oh,
time.
and I
Yeah.
I realized I didn't even, that was the only one thing.
Okay, no, go ahead.
If you don't mind, my second,
Sure.
so sorry. Obviously I'm very excited about all these things. So yeah, um the second thing that's really come up is I've had a lot of women present with abnormal cycles, endometriosis, chronic pelvic pain, um, perimenopause from hell, older age with osteoporosis and loss of urinary bladder control and poor sleep and hot flashes still. And it's really woken me up to the idea of hormone replacement for women, and now looking actually to men with osteoporosis from what we call andropause and low testosterone, etc. I There is a really, really big myth out there that hormone replacement is not safe.
Mm.
And um, as with many things in medicine, it takes decades for things to shift and change. And there's a whole world of what's called bioidentical hormone replacement therapy, which is very different than the conventional world of hormone replacement, which, by the way, fun fact, for instance, maybe you've heard of Premarin, which is a vaginal estrogen. Okay, very commonly prescribed in the mainstream world. It's derived from horse urine of pregnant horses, hence Premare in urine from mares. Anyway, fun fact. Anyway, so this is a very different constitution of hormone and often at a much higher dose without considering the progesterone and testosterone that comes to play in natural physiology along with that estrogen. And in an already super estrogen dominant society, we don't necessarily want to throw a lot of estrogen at women or men. We probably want to look at progesterone and testosterone too. And we probably want to do the lowest effective dose. Anyway, this is where the bioidentical world has come up. And yeah, I have patients who are just like blown away by the efficacy of a topical tincture of hormone and what it can do for their overall well-being. Not to mention the best primary care when you're preventing osteoporosis, loss of muscle mass, cardiovascular disease, cognitive decline and dementia. You're delaying onset to nursing home. I mean, amazing, incredible things that can be done with a tincture of topical hormone. I mean, it is incredible
Wow.
and safe and effective. Oh, cancer prevention.
Wow.
Um, wow. I mean, it is wow. It is one of those wow. And so I keep having these moments where it's like I had all these questions as this curious person in primary care, like of these, really sad, upset women a lot of the times. And I'm just like, I have no tools. I don't know how to help them. And this is one of those tools that can have a profound effect on health and healing and well-being and prevention. And I tell people evolutionarily, we didn't deal with this, right? We're kind of new to this aging thing. And I'll tell you, having that little extra bit of hormones can go a long way for people's health and longevity.
Wow, that is wonderful to know. I appreciate learning all that.
Yeah.
Um, so the other thing I'm hearing in your responses is how passionate you are for these topics. And so I think we'll move on to my favorite question, which is
Sure.
basically if you could marry this passion with some power and authority in our healthcare system. Let's say you wake up tomorrow and you discover in a fantasy that you have been overnight become the Surgeon General or president or let's say Queen of the world. Um, what might be one of your first acts in this newfound position of authority?
What comes to mind is restoring humanity.
Okay. I like that. Can you be any more specific?
I think we've all lost touch with our own humanity and what that means individually, in collective community, in communities of various perspectives. And being human is hard, and there's a lot of struggles, and we are better in it together. And I mean, one of the principles of osteopathy is we truly, truly, truly are part of a natural world and a connected natural world. And it's when we lose sight of that connection and we become isolated, for instance, COVID, I mean, we do not do well. And there is so much power and health in community and humanity and shared experience and just, and just acknowledging and living in that. Um, yeah, could go such a long way.
Yeah, wow, Katie, that's beautiful. And I totally agree. I mean, I think so much of both of our work is trying to build a healthy relationship with a person at a time to try and support their own healing. Um, and I really appreciate you putting that explicitly. And, also acknowledge that uh, you're easy to get to know. And so I think you put that into practice too.
Yeah, absolutely. There's something about, I think of Brene Brown and her whole vulnerability research and amazing talks and books about it. But I mean, there is something contagious, I think, about how being open and vulnerable in a space with someone. Um, and I've had patients remark on that, and they notice and feel safe and can, yeah, find themselves saying things they never thought they would ever say to a doctor. Um,
Right. Yeah, they're experiencing you in a very different way than a traditional medical environment.
Correct.
Mhm.
And it helps that I have a living room here. So we
Right.
actually take our shoes off to enter the living room.
Yeah, exactly. It feels like somebody's home rather than a sterile environment.
Right. Which
Yeah,
is so important.
yeah.
So important. I even have my God bless the people of Lebanon, Oregon, who welcomed me as a medical student to their town where there was a new branch of a medical school, Western University. It was the Northwest branch. And they pooled together their resources to buy every incoming student, this was classes of 106,
Oh,
a leather doctor bag. And I have it sitting
oh,
right here. And I can't tell you how many people have remarked on my leather doctor bag, which is, this old traditional kind of house call doctor type bag. And yeah, I mean, I actually, you're helping me recognize the symbolism there that probably some patients have picked up on as they're remarking on, wow, I just love that doctor bag. It just really, it's like that. That's where medicine will, I mean, that was a large part of medicine. You could be a home visit doctor in mid-century, and um, that's a thing of the past now.
mhm.
So
So what I'm hearing you say is diseases can be contagious, but community and healing can be contagious too.
thank God for that. Yeah. Yeah.
Well, Katie, it's been absolutely delightful talking to you. I've learned so much. And we're running low on time. So one of the things I really enjoy doing is allowing my guests have the last word. So is there one point or topic you'd like to leave us with?
Such a good question. Um, I guess I'm just come over with gratitude and just I thank you, Peter, for really putting this out to the world, these real topics that need to happen to restore that humanity. Um, and gratitude for my patients for trusting in this medicine. They had no idea what it was. And for telling all their friends when it started working for them. And um, gratitude for Dr. Still for his, pioneering spirit, and for the universe for communicating with me and my body for communicating with me and helping me be on this path to um, hopefully help instill um, livelihood and health into many. So I guess thank you.
Amen to that. Well,
Yeah.
Katie, I've really enjoyed our time together. Look forward to future conversations. And uh, my sense is your hope is infectious.
Hope is okay, fine. One more word.
Okay.
So so the pathway to healing, this is summed up so well in so hope can lead to love, which is directly connected with healing.
Yeah, that's beautiful.
And so let's get on that journey together.
I can't think of a better way to end.
Yeah.
All right, Katie, we'll see you around the neighborhood.
Sounds good. Take care.
You
Bye,
too.
Peter. Thank you
Bye.
again.
You're welcome. Thank you.
Take care.